Welcome back. Well, while diet and exercise may be part of your New Year's resolution to look better on the outside, you may want to start by finding out what's going on inside your body. And that's why Dr. Scott Walker is here this morning from Starling Physicians. I was combining your last name and your group. But thank you so much for being here. I love these tests. So let's talk about the first one. We're talking about fasting blood glucose. What does that measure?
So it measures glucose in the body early in the morning before you've eaten anything. So it's a good way to detect if you're starting to become an early diabetic, which is very important because at that stage you can actually change diet and lifestyle to be able to reduce your chances of becoming a diabetic. So it's a very important stage to intervene on. If you're a little higher on the sugar, it's a point where sometimes we'll start some medication early, again, trying to get you from becoming a full-blown diabetic. The other thing to understand is sometimes you can have very high sugars and not really have many symptoms. Some people, the first signs are just sudden weight loss where they don't really know. They maybe think, hey, I'm doing a little bit better. In reality, it's just their sugars are very high. And so you actually end up having a high urine output and you lose a lot of calories. And so sometimes one of the first signs is really thirst and weight loss.
Interesting. Next, lipid profile. What's that?
So lipid profile checks your cholesterol that everybody typically talks about. There's a couple different particles that we typically look at, which is LDL, HDL, and triglycerides. The HDL is the high cholesterol. It's the higher the better. We know that high levels are very good in reducing disease and problems for people. Unfortunately, right now we haven't really found too many drugs that seem to affect it that have a difference with that, but we know, again, exercise is huge for increasing your HDL. Fish oil seems to help, although we're still not entirely sure how good of an effect it has as far as reducing heart attacks and strokes. The LDL is the main one that we look at. That's the one that we target with medications such as statins. There's atorvastatin, Crestor are common ones. There are also some new injectable ones that are brand new to the market. They're out there because a lot of people can't tolerate the statins. They have trouble with the muscle aches. And so because we do have patients out there where we really want them on these medications to reduce their heart attack or stroke, they came out with these injectables that are better tolerated.
And blood pressure, most people get that checked every year when they go to the doctor. Thyroid screening, does everyone really need this?
Not quite everybody, but it's an important one to check. 35 and over we typically do. Again, it's one that you may not necessarily have big time symptoms. You know, you might just be feeling tired, maybe a little constipated, maybe you think you're just not getting enough sleep, you're having trouble losing weight. Those are all common reasons that someone could have low thyroid. And it's one that if you find, someone can feel a lot better once you start treating it. So it is good to look for it.
And next is colonoscopy, but that's also for people at a certain age, right?
Yeah, so colonoscopies age 50 and over, unless you have a family history of colon cancer. Then it's 10 years earlier than your relative who is diagnosed with colon cancer.
Good advice there.
And there also is a new test on that, which is Cologuard, which is a new screening test. It's a genetic test for the stool. It's actually recommended in combination with colonoscopy. It's brand new, just came out this past year.
Interesting.
It's really highly sensitive, so it's a great screening test. It does not replace colonoscopy. It's in addition to it.
Next is Pap smear. Most women get that every year. Mammogram, I know the guidelines have changed a lot for that.
Mammogram, you still, I believe, want to do it 40 and over. There is some debate about when you start. Certainly the big thing is making sure that you do regular breast exams monthly on yourself, yearly with a physician, without a doubt.
For men, prostate screenings, when do those start?
So that's actually a big debate in medicine right now as well. It depends on which society you want to look at. Basically, the biggest thing with prostate screening is you want to discuss the risks and benefits with the patient, and depending on age and their family history would depend on when you start testing and go from there. So it's really a personal decision with the patient, understanding that if you test a little earlier, you might end up having to go for some prostate biopsies. And the other thing is you may end up just finding a cancer that's a slow-growing cancer that may not necessarily harm them. However, what we're looking for is the aggressive prostate cancer that could become a problem. So right now, there is big debate in medicine about when do you start, and the guidelines basically say you want to discuss it with each individual patient depending on their risk factors.
Well, that makes sense too for most of these screenings that you might want to consult with your, well, you will want to consult with your primary care before you go ahead with a lot of them too.
Exactly, yep.
All right.
So, and a lot of them would change depending on what type of family history you have, and the other thing is there's always new guidelines coming out and new tests. So,
I know. That's
yeah.
why we have to stay on top of it. And we also let the public know when we hear about the new screenings and new guidelines. So thank you so much, Dr. Walker.
No
Some
problem.
great information.
Thank
if you want more information about Dr. Walker and Starling Physicians, you can head to our website, WTNH.com. Just click on that on-air tab and pull it down to the Good Morning Connecticut weekend section. And happening today, all Sam's Club stores are actually offering free health screenings. Those tests include blood pressure. We talked about that. Total cholesterol, HDL, the good stuff. Glucose and body mass index, vision and hearing tests are also available at some locations. There are 2 Sam's Club stores in our state, one in Newington, one on the Berlin Turnpike, and one in Orange on Boston Post Road. The free health screenings are from this morning until 4 this afternoon.